What's up, team? Happy Wednesday. What a perfect hump day to have a great LinkedIn Live. So I'm here with good friend, Jeff Beecher. We've been hanging out for a couple years now, and I'm really excited to have him on today. It's going to be especially relevant for all my executive coach audience because what he does, he's a commercialization expert in the medical device sales field. So basically what he does, he brings medical devices that nobody has ever heard before and brings them into the healthcare system, which is an extremely complex, hard to break into field. So it's going to be perfect for us to hear about this because as executive coaches, as me being a coach, we're trying to reach hard to reach people. We're trying to get into organizations with tens, hundreds, thousands of people and reach those decision makers and create relationships with them and take all the steps necessary to get our products, in this case, not physical, but our products and our ideas and get people to buy from us. So, first of all, how the heck are you, Jeff? How's everything going?
I'm well, RC. It's good to be with you. Thanks for having me today.
Yeah, for sure.
How are things in Brazil?
Oh man, it's good. I've got a couple of spider monkeys running around in the trees over here, so it's always nice to see them. And it's a bit rainy, but like we were saying before, there's a lot of green here, so we need some rain. We need some clouds once in a while. I'm not bugging at all. It's the rainforest, yeah. And what about you? You're off to New Orleans, right?
Yeah, I'll be leaving for New Orleans. I got a conference down there, so I'm sure we'll bring that up during our talk. It's part of the process. So yeah, I'm heading down there for the weekend.
Nice. Yeah, hope to, looking forward to seeing some LinkedIn posts from you. So I'm sure we'll get into those. But okay, so the first thing that I want to ask about is this idea of creating relationships in hard to reach places. So we talked, healthcare is one of the most difficult places to reach people and talk to people, right? I mean, there's so many different layers and everybody's busy and we're dealing with very serious kinds of things. So I guess, I don't even know where to start to ask you, because I know you've been doing this for so long and there's so many things to think about, but what's maybe the first thing that you think about when bringing a new device into the industry or some place that you want to sell it to?
So, it's a great question. There's just so many steps in this process, but at the top of it all is the patient. If the solution or the innovation is something that I can understand and I can see the benefit that it's going to have on patients, I start there. That's the first place. And if it's usually the things that I've been involved with for the last couple of decades have been ideas or innovations that have changed, patients are being treated, for the better. You try to, and it's hard to discern, but you take all the things that all the things that you've learned and you apply those things. And then you talk to physicians, you talk to nurses, and you make a decision. This is something I want to move forward with. And once you make that decision, then, that's when the rubber meets the road. And then it's time to introduce that to, like, I'm going this weekend to New Orleans, and I'll be at a conference with interventional nephrologists, and we're going to be doing just that, talking about the innovation that we have, why it's good for the patient, why it's good for the physician, and hopefully why it's going to be good for the enterprise, the hospital system, the ambulatory surgery centers. That's the mission this weekend. And hopefully we'll garner some attention from, I liken us to be like the farm team of a baseball organization. We bring innovation, and hopefully the big leagues will pull us up, and that's the idea is, we're small. We start with a limited launch. We get success going. People see it, and then would hopefully, an exit or an acquisition occurs, which would bring it to the broader market and indeed to the world.
Yeah. Nice. Yeah. So to me, I think the most interesting thing that you said, me thinking as a marketer, is that you said that you bring that when you talk about a product, you talk about why it's going to be good for the patients and how it's going to be good for the physicians. And what you didn't say is you go and you start talking about the different features of the product and the way that it works. Because this is, I think, the major mistake that anybody who's selling anything does is they talk about features and not benefits. So like for me, if I'm an executive coach trying to sell to an executive, I'm not going to say that, I'm not going to say that I have a 4-step process that just brings better confidence in communication. I'm going to say that my process is going to help so that your people aren't communicating in silos anymore, but they're working together in a kind of decentralized way where everybody's on the same page at the same time. And it's not just going to make you more confident as a leader, but it's going to be so that when you walk into a room or have a kind of Zoom call, then everybody is paying attention as if they were in person and people are engaged and asking questions. So that's the way you got to talk if you want to sell, especially for an executive. It's what's in it for them. What's going to the benefit going to be? So Can you speak more to that? Like, how do you talk about the device when you're trying to sell to somebody or get it up the line?
Well, it's you can see the book behind me. It's called Relational Selling by Ansel Lee III.
I've heard of that one.
Yeah, you've heard of that. It really, I'm not that hard charging. You can't be really. There's no sense in being, hitting people over the head with features and benefits when you're so far from that aspect of things. And you just try to really meet people. I'm going to New Orleans. I'll be meeting a lot of folks, and hopefully, they'll engage me, and we'll get to talk about the problems that we're having in dialysis, which are innumerable. And so when you start having dialogue with people, it can naturally just come out, well, what are you working on? And so, well, we're working on trying to solve the stenosis at the venous outflow. Oh, really? Yeah. How are you doing that? So it's really more conversational. I really tried to stay away from, hard selling right from the get, and right from the jump, because I don't know. You're trying to engage physicians at this level, and you want to have a mutual sort of relationship going. It's got to be, they've got to trust in you, and you got to trust them to make good decisions. Because after all, this isn't, what we're implanting things into people, and we need that sort of mutual trust and respect, and they have to understand that I'm in it for their patient and I'm in it for them. And so it's kind of a long process, but it's worked for me. I when we get to the moment where we're actually in the operating room, all the things that I've done leading up to that, and it's a myriad of things. All the things that I've done have caused me to check a bunch of boxes, and in doing so, I think there's some trust that has occurred during that 3, 4, 5 month process. You try to do and say and complete the mission, get the trust going, and then when that day comes, you're part of the team. That's what you're trying to become, is part of the team, part of the operating room team. That when you're there, you're an advocate for them. You're an advocate for the patient. And, my mission is to get that patient, treated properly and out of the room and on their way to healing. So I think the physicians and nurses that I've worked with understand that about me. And those are the sort of things I work towards, is trust, honesty, integrity. And it's right up there in that. It's relational selling. It's doing what you say you're going to do.
Yeah. I want to ask you about this trust and how you do it. So, so for me and in my clients, like the way that, we don't do networking events. It's not, we can, but it's not really part of the strategy exactly. So, for me and my clients, as far as what I teach, trust is about everything we can do basically through social media and one-on-one calls. So I think the mistake most people make is maybe they just create content and they put out posts that they're like kind of surface level generic stuff, a lot of factual stuff. And it like puts you there as being consistent, but it doesn't actually build trust that's different than anybody else that's out there. So the way that, that we do it is okay, what is your program? Let's break it down into all the different features and kind of benefits of it, so we can tell stories about it. Let's do testimonials. Let's do personal stories. Let's tell the bits of the story over a long period of time so that we can build that trust. And then when we do finally say, hey, I've got something that you can buy that's going to help you, then people are like, oh yeah, that sounds great. I'd love to talk to you. I've been hearing about this for a month, for 2 months. So that's how we build trust, through content and online. So curious for you, like, what are some things that you do, to get to that operating room? Like, what are some things that you do to build trust, or what do you think has maybe, set you apart or given you the most success to get there?
Well, I think you said it in a moment ago, where it's something that happens over time. In my business, time is, we have a lot of time to get through all the things that I have to get through. The FDA clearance, the reimbursement piece. These are all government sort of driven things, and then I have a VAC committee, a value analysis committee, that I'm going to be before and in front of. I need to really, the first step for me is to gain the trust of the physician. And I need him to be he or she to be a champion, an advocate, so that we can make the case together before the committees and before the C-suite, actually. I mean, and it all has to line up. It's got to line up for, as I said at the onset, it's got to be good for the patient. It's got to be easier or better for the physicians and staff. It's got to be profitable. It's got to be reimbursable by the government entities, or if it's, hospitals have to make money or they don't survive. Insurance companies have got to buy into it. So there's all of these opportunities. They're opportunities for me. It's part of the process. Opportunities to build trust, to get people to understand what we're doing and how it's going to benefit the whole, everybody involved, the from physician or from patient down the chain. So my process is inherent with, just a lot of contact and a lot of opportunities to build trust and gain people and good relations.
Yeah. And I've got another question for you about that. But one thing, that sparked for me is this idea. It's not super related to what you said, but again, it's kind of from the beginning. It's the way to get to a decision maker, and to get, somebody to buy, an executive, a company, a hospital, is to make the business case. You said hospitals need to make money to survive, and that's true. Businesses need to make money to survive too. And one of the first things I work on with clients is the messaging. It's, what is the specific message that is going to get someone to see you and be like, yes, I need to have a conversation with that person. And you know what? It's not necessarily that it's going to save more lives, is that it's going to make people feel better. The message that you got to send for this executive that's going to pay you is like, this is going to help the company increase their speed of productivity. It's going to help to increase profit, make your team operate as if they were twice the size, make it so that there's double the innovation. It's not about the soft willy-nilly things in the beginning. Like, if you want to attract attention, it's got to be, hey, you implement this now, you're going to have more resource, more speed, or whatever that is. And a lot of people get kind of bent up about that. They don't, I don't want to be like salesy or something, but it's not, that's not what it's about. Messaging and sales is about, I think it's just about connecting with somebody and starting the conversation is what you got to do. Yeah. And so that's for that. If you got something to say on that, please do. But I wanted to link this into your One More Row story, because I think that is probably one of the ways that can demonstrate that you've been able to build trust, to do that in the first place. But then maybe it has something to do with trusting yourself, trusting with the trust you built with the people in the hospital. So, I'd love for you to share that story too.
Yeah, I never really thought about the trust that was involved there. But if you want me to go into it right now, so there's years ago when I wasn't a rookie medical device rep. I was probably 10 years into the business, so I'd become pretty savvy, and I've been in many cases, and I was working for a large company, um, and I was in the case in the morning. Started at 7:30 a.m. and I got to the locker room, got in my scrubs, showed up at the case, and this case usually only takes about 2 hours, but this was an inordinately long case. It was like 5 hours, and that's a long time to be in the OR standing. Um, and when the case was over, I had about a 2 hour drive home through the mountains and Southwest Virginia, and my kids were younger, and I had a son playing little league, and the two girls were in gymnastics, and I'm in the locker room thinking, oh, just get in my street clothes and get on home. Maybe I'll catch, play ball with my son or something. And so I thought about it. I got in the car and I'm like, oh, there's a Memorial Hospital right over there. I will make one more call. And this kind of goes back to when I was a kid. I used to work on a farm in the summer, my sister's farm, and this guy would have me out in the field, and he kept saying to me, let's just do one more row, and then he kept saying that to me all day. And before you know it, we'd been out there, for hours, and finally the field was clear, and, and one more row is just sort of, and I was in that same area, and I thought, we'll make one more call. I could go home. So I made one more call, and this was a competitive hospital. I didn't have the business here. My competitor did, but I thought, well, I'm just going to go up there. We had a new device, and I just thought I'd leave some literature and say hi to everybody. Just there were folks in there that I knew, and so I did. I went up, and the sliding glass window opened, and talking to Betty, whoever it might have been. I said, look, I just want to leave some information for Dr. Jones on one of the circulators. A circulator is somebody that goes in and out of rooms getting sterile product for the case. She saw me, and she asked me to just wait right there a minute. I go, I mean, this was very unusual. So I did. I waited, and she came back out. She said, Dr. Jones would like you to get in scrubs right now. That doesn't happen. It doesn't happen at all. So I got in scrubs. Actually, I got into what they call like a bunny suit. I threw them over it was that urgent. So I got into something sterile and had my sterile bag with me, and then went into the room. Actually, I didn't take my bag in the room. You can't do that. That's a no-no. So any of you OR nurses out there, don't call me on that. All right. So I went in, and I had never seen anything like it. I'd been around a while, and I thought maybe this was a gunshot or something, because there was a lot of blood, and that's not typical, for the cases that I've been in. Hemostasis and managing blood is just part of operation. This was a problem. There's a problem going on, and he showed it to me. And there was a failed staple line. We staple tissue. And this staple line failed, and there was a real issue. It was deep. It was in a place we couldn't get to easily, and I had what was considered to be it was a new product that we were bringing out, and it was an emergency. So I said, I think this device will get beyond that, and that's exactly what we did. It was in a narrow area of the male pelvis. We fired it. We got beyond the failed line. And then we did the anastomosis, and that patient went on to have what I hope was a nice recovery and maybe a happy life. And I didn't really think anything of it, because that's just what we do. It was years later when I thought about, what if I don't go? What if I just go home? What if I don't make that one more call? And then I realized that the things that we do, we bring in innovation and our work, and whether you're a doctor, a nurse, or medical device rep, or health tech, software, your job, we all have important things we're doing. I felt like, making one more call that day made a difference. It's not about me. It's really about, working, putting in a good day's work. And you never know what might happen. And in this case, I felt like, we did some really good work. That patient avoided, maybe a colostomy, and making one more call. I still got home, in time for dinner. Still, maybe I didn't, play catch with my son, but we did it the weekend. It's like, so anyway, it's. I think it was more about work ethic and than anything. And yeah, I mean, you looking back on, there's probably been a lot of cases like that have happened. And proud of my career, and it's not over by any stretch, but it's been a really fun. Yeah, I don't know how this can be deemed fun, but it's been a very exciting career for me, and I've enjoyed it. And the people I've met, some of the most outstanding healthcare individuals that are truly my friends now. It's that's the byproduct of it all, is some knucklehead like me gets to hang out with some of these world-class, physicians and nurses, and, just very lucky.
Nice, man. Yeah. I love that story. Yeah. I really love that story. I love the way that you just told it. But I want to bring it back to trust though, too, because, I think so much of the story you just told and so much about success in sales is consistency and being in the right place at the right time. So you went into that hospital that day and there was that problem that was happening, and that, the person doing with the, running sterilization equipment saw you, and they're like, we know Jeff, we know what Jeff's got, what he's got is going to be able to save this person's life. And that never would have happened if you hadn't, been to that hospital multiple times and built relationships and told people about what you did, and then had that consistency to go to that hospital that day. And, that's so much about sales. Like, people get into coaching, especially executive coaches, they've had referrals and word of mouth for their, a lot of them were executives and come into coaching and sales, and they don't really realize the work that goes into the coaching business part, and realize that so much of it is having these consistent relationships, and that when you do it every day, you get into the right place at the right time, where there is going to be that person that is having that crisis with their team, or wants to move to the next position, or wants to be a better leader. And then they're going to think about you and they're going to hire you. So that's why we create content every day. And that's why we're reaching out every day and doing this. And that's exactly what happened to you. In your case, it saved a life. And what happened, whatever happened, did your device end up, like, did they buy?
That's a great question. And I'd love to tell you that that's what happened, but that's not what happened. But the physician was very grateful for my being, and we knew each other. He was just part of my my competitors. He was kind of their faculty, but I never did convert that hospital. Just being honest, it would have been a great story, right? I could have just told you, I got all the business. That's not what happened. Yeah, that's not what happened. And I also just want to make one thing clear. I don't believe we saved his life that day. I think we saved him from having an awkward life, of a colostomy or something like that, which has been a stigma. It's just hard, and people live with those. And I really admire the folks that are out there. So I'm not trying to minimize that at all, but I just think that I want to make that clear. I don't believe I saved or we saved him, but I think we just avoided a very difficult situation. And I think, the physician was very grateful. And I never will know the patient. He'll never know me. And that's fine. I went to my car and felt like I did the right thing that day. I went home. I didn't go home. I made one more call, just
all right. Yeah. Nice.
Yeah. So it's fun.
Okay. Yeah. Cool. Yeah. Another lesson here, and just like storytelling, like the way that we can spin anything, I just talked. You told, that's what we've been doing back and forth here is like is telling stories and just kind of like taking random bits. We're taking random bits of information from our lives and we're spinning it in some ways that's creating some kind of lesson. And it doesn't, I mean, we got to be truthful, right? You know, I don't want to say that you saved a life and then you didn't. It's like, we should probably clarify that. But I also want it to be clear to people that when it comes to creating content and getting points across and yes, changing people's lives and getting them to buy, like, story is so abstract. You can tell a story of anything, any little thing that happened. Like just yesterday, my food was late from this company and I canceled this order. And I made this whole post about urgency and how urgency is so important to get people to take action and to move and buy from you. And, you know, I watched another movie, Man on Fire with Denzel Washington the other day. And it's about, you know, it was this relationship between a girl and her bodyguard. And I turned it into this story about how you got to tell backstories about who you are and what your company is to get people to buy from you. You know, their stories are endless. So I want to like really hit this point home that story is the best way to emotionally connect people to you and to get them to take action. And that, man, everything's a lie. You know what there's this, what film is, I heard this great quote. I don't remember the guy's name, but said film is, maybe the quote is film is truth 24 times a second, except maybe it was truth as film is a lie. I don't know. I thought it was something like, it's like, but it's actually a big lie because it is, you know, it's from your perspective. And that's all that really matters. So,
yeah, storytelling is, you know, and you're one of the best. There's no question about it. I love your content and the way you tell a story. You've helped me tell stories, and because sometimes I get in my own way. You know, I know there's a good story there, but I think you're getting me to start thinking more about like one more call. And there's other things that, you know, there's other folks that I've met on LinkedIn. It's been such a great experience for me over the last 2 or 3 years. You know, know, like, and trust is what we're trying to achieve here through our content, getting people to know us, like us, and trust us. And, you know, that carries over into what I've been doing my whole career. You know me, trust me. Once you get to know me, and once I start telling you that I'm going to do something and I do it, then you start trusting me. And when you trust me, then, you know, all bets are off, really. I mean, if I trust you, you trust me, then we can do a lot of things, you know, together.
Yeah. And I think too so, you know, I want to ask about a bit about like your LinkedIn and, you know, the way that you've been sharing, and you had a recent, you know, massive post that a lot of people resonated with. And so, you know, because what you just said about liking and trusting and, you know, getting people to want to hang out with you or buy from you or whatever, I think so much of it is proximity and being present in people's lives. It's like, you know, we know our family and trust them the most, I think mostly because we've been around them the most. And there's billions of people in this world. And, you know, we have like kind of like the friends that we have are the ones maybe that we make at work that we see every day, or the neighbor that we talk to every day. And I think it's a lot more basic than people think too. It's a matter of exposure and being authentic, putting yourself out there, and things just compound on each other. And probably the most important part is that you need very few relationships to be really successful. Like, how many clients do you really need? In an industry like yours, one sale into a hospital is probably $100,000 plus $1 million making a sale. Same with being a coach. You know, you can have a client that's giving you 10K a month on a retainer, or you can connect to one person that knows 20 people that when they refer you, they're all going to buy from you. So it's like, it seems daunting in the beginning to be creating content and being on LinkedIn, but you only need 1, 2, or 3 things, and it's like can really take off for you. And
well, it's so true. I mean, I think for me, when I start working with a physician and they go to a conference and they start talking about our procedure and, well, who's the rep? You know, next thing you know, I'm being pulled into a larger, you know, that's the way it happens for me. And that's what you're trying to coach your clients on, is it just takes one, you know, and just do the right thing. Let them get to know you, let them get to trust you. and they'll like you, and and then the business will grow. Um, it's on LinkedIn. You and Ansel have been, sort of driving this home to me. Content, produce. Doesn't matter. Just tell a story. Like the story I told the day before yesterday. Or I'll see something that really touches my heart. It's got nothing to do with my business, but I saw a little girl that she was blind, and her mom was guiding her to her nanny's house. And when she saw her nanny, it's just like, well, how sweet is that? That's like the sweetest thing I've ever seen. And I reposted it, and it got like 10,000. People they agreed with me. They're like, yeah, that's the sweetest thing I've ever seen, and it needed to be shared. And so, I think like you and like Ansel and like others who see things and it touches them, share it with the world. And then, of course, if you can connect with people, helping them like you do, coaching and telling stories and how to get their product out there or service out there, it will happen. This is a great platform. It's an amazing platform, LinkedIn.
Mm-hmm.
You agree?
Yeah, I agree. I'd share that quote from Jeff Beecher.
Oh, good.
So, well, maybe one more thing about LinkedIn then is like
I'm making LinkedIn history right now, so that's good.
Yeah. Oh yeah, we are. We're gonna share this stuff, definitely. How do you see yourself using LinkedIn more? So maybe as a person who started LinkedIn, or like you've been using it a lot only the past couple of years, how do you see yourself using it more, and why?
Yeah, well, I think it's going to kind of broaden my view of things. I've been in the operating room or in surgical medical device sales for a long time, and I've enjoyed it. You can tell. And I'm in another startup right now, which is really important. They've all been important products and innovations to bring. This one's real important to me, and I'm going to see it through. We've got a long way to go. I've been here before, so we will see it through. But beyond that, if we get to an acquisition and it's an exit for me, and then I think LinkedIn is going to be an opportunity for me to coach, like you, help people. I mean, I'm learning from you. I've got all these stories in me, but you're bringing them out of me. I never thought about telling a story. A story that would help people. I'm a storyteller, but you can tell a story, or you can really, create something that's important by telling a version that's going to resonate. So I see myself maybe moving in that direction. It doesn't have to be a medical device anymore. It can be health tech. It can be it'll be in healthcare, I'm sure, but doesn't necessarily. And I keep saying this. I have to tell you right now, RC. I said this for like 20 years. This will be my last device. And then I find myself right back in the device world again, which maybe that's what God wants me to do.
Yeah, maybe. I mean, I think just got to follow your gut on that one. God's guiding you through whatever you're doing. If it feels right, even if your mind was saying no, if it feels right, you gotta do it. It must be the right thing.
Pulls me in, pulls me in. So
yeah, nice. Well, okay, man. I think we got through everything that I wanted to get through, and I think it's been a great conversation here. But any last thoughts? Any last words?
Yeah. Did I tell you? Did we mention this in the green room? That my last thought is in commercializing a medical device. When you're out there in the real world and you're not in a commercial device, you want to create a win-win situation. In the device world, medical devices, there are so many layers. It's a win, 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 win. I mean, you got to win everything, starting with the patient right on through to the C-suite. there are just so many barriers, or I don't know how to describe it, but there's so many things, boxes that you have to check, and every one of them have got to be wins. They all have to be wins. And anywhere along the way where you don't get a win, it's not moving forward. You know, it's done. So it's not for the faint of heart, but I certainly have learned a lot, and I've loved my job, no doubt about it. So anyway, that's my final thought.
Okay, well, maybe let's keep going on this for a second, because I feel like this could be like post live. Like I'm going to cut up clips for us, and I think this could be a great clip for you to kind of, can even feed off what you said. So, how, and I can attach it to this first part about wins. So speaking of that, like why do you think, either like, what do you do? How do you think maybe how do you think you do things differently to get those wins and get all the way up there? Like, why do you think your process works? Or maybe, why do you think your process works to get those wins up to the top? Like, how are you able to do that?
Well, I think, again, I think people who are successful in this business have, well, I should say, you must have the patient on your mind. You what you're doing has got to provide a great outcome, and it starts there. And so that hasn't really much to do with me as it does with the innovation. Perhaps I'm the smart guy that's, my gut, let's just go with that. My gut tells me that, and, with some investigation and some, research, I've made some decisions that, we're good. I've gotten behind the right innovation. And then, selecting the physician that would, in interviewing them or them interviewing me, you find the early adopters. You find the folks that are, this is something that's really in their wheelhouse. This is what they want to do. They want to be a part of something new and innovative. They want to speak from the podium. They want to be, along for the ride. There are a lot out there that don't. They just want to follow the crowd. Wait, give me a couple years. After this is successful, then come back to me. Get that all the time, and that's fine. But so you really kind of have to cull through all those physicians, and then once you find that right doc, and you've cultivated the relationship, and there's trust, there's no like and trust involved, then we're partners in this, and then. We start the process of getting through the myriad of things that we have to get through to get it into the hospital system. And it can take months. It can take it can never happen, but it's usually a 6-month process. It can take that long.
Nice. Yeah. I think that ending part was great, especially. Yeah, you got to find your insider champion, right? So you got to find the right kind of physician that is willing to, and that likes to be the early adopter, that likes to take on new technology. And that's part of your lead generation or your prospecting process, is figuring out who are the physicians that like to be the laggards, that like to take stuff after it's proven, and then who are the ones that, if you're bringing new device into the industry, you got to find those people that like to be the early adopters, and that takes skill. That takes skill, and it takes a good gut. It takes the right eye to find those people. And you having so much experience, you're really good at identifying those kinds of people. So then, therefore, you're probably better than most people at getting new devices into hospitals and getting them sold, because you know how to do it.
Well, and part of it is, and never underestimate the network. My personal network. I mean, I've got so many friends, in the same side of the business, the medical device, but physicians. I mean, there's always a way in for me. It seems, I got too many friends out there, and I would do the same for them. I mean, we just help one another. And so, yeah, it's never underestimate the network. Your network is, and keep it close, keep it cultivated, keep it fresh, feed your network, so, they'll help you, you'll help them. Like, you're part of my network. Thank God,
Oh yeah. We got plenty of food for all the whales out there that got all that money for us. Don't worry. We got plenty for you.
Let's feed them.
Whales. All right. Well, sounds good. I think I'm ready to wrap it up. How are you feeling?
Yeah, I got to get to New Orleans. So
Gotta get to New Orleans. I've got to go feed the monkeys out here. So let's call it a day. All right, guys. See you later, LinkedIn.
Thanks, man.
Thank you.